And so that's the way to avoid, to prevent eczema. Of course, these are new studies. We don't have long-term follow-up. I'm not sure whether this is a treatment for life, but at least it's a step forward showing important information on the role of the skin as the organ where sensitization takes place. So, if you talk about steroids, only topical, as mild as possible, only on the patches, not on the whole body, and maximum twice a day. You have to be careful with the so-called proactive treatment, and I know some doctors in the US advocate it preventively, but actually you don't know what you're doing. And by using the whole body, by using steroids on the whole body, I'm not sure whether it's 100% safe. So some doctor will say you have to do this like you treat asthma. You treat asthma preventive with inhaled steroids, but I'm not sure if the safety is the same. And you have to be very careful with systemic corticosteroids. And what you have to avoid, as much as you can, in the treatment of eczema, is all oral medicine. Antihistamines, immunosuppressants, and antibiotics. And all extensive diets, it doesn't work. And of course, keep it simple. Keep your treatment simple and keep it child-friendly. Yeah? If you go for complex treatments with a lot of things the parents have to do, they don't do it. Because this is a chronic problem. Eczema is a disease that can take years, so your treatment should be very, very, very simple. And then the future of eczema, of course the future is a causal treatment and preventive. But I think a good step forward for all of us, and we in Singapore are working on a schedule, is to come to a corticosteroid-free treatment. And I think we can do that, because now we have immunotherapy. We know that it works in eczema. We have those new barrier restoration treatments, and we have other treatments that we can use. So I think for a large group of children, we already can come to a treatment, should be tailored. We can come to a treatment without corticosteroids. And of course you have the wet wrap. Children don't like it. So I know some doctors use it a lot, mainly in Europe, but the doctor likes it more than the child. So I try to avoid this. What we do in Singapore to keep the germs low on the skin, and that's very important, all our children have to do this 3 times a week. They have to go to a swimming pool with chlorinated water, and then the germs are low, and then you can treat that. And you have to prescribe a tailored schedule according to skin type. They have to avoid the sun. If they have a very dry skin, they can only go 10 minutes in the pool. They have to use a lot of moisturizer. And in the meantime, they stay outdoors, because in the pool, there's no house dust mite. So you avoid contact with house dust mite. So all our children have a tailored swimming schedule, and that makes us able to treat a lot of them without steroids. I'm going to stop here. If you have questions, you can ask them during this day. Thank you for your attention.
Xin cảm ơn buổi trình bày của giáo sư Hugo Van Bever. Thank you for Professor Hugo Van Bever's presentation. Tiếp theo sau đây, tôi xin trân trọng kính mời tiến sĩ bác sĩ Lê Thị Hương trình bày bài báo cáo tỷ lệ nhiễm mắc già và trẻ dưới 5 tuổi tại 3 thành phố lớn của Việt Nam. Xin trân trọng kính mời tiến sĩ.
you.